I was going to ask about treatment time. You know, we speak a lot about kind of, you know, how many treatments and just kind of managing patients' expectations. You know, how would you go about that? Is it as long as it takes, or is there a kind of requirement?
Number of sessions, you mean?
Number of sessions,
Okay, so we get asked this quite often. And the original protocols were based around a 20-session treatment program. And what I start off by telling my patients is to say, listen, if you want to get the best results from it, that's where if you look at all the patients and think of a bell curve, that's where the majority of them would fall. That would require that type of number to get the maximum or optimise the outcome. With that said, you will have some patients who are better than that, and some patients are slightly worse than that, the outliers, let's say. And the best example I had of that was actually a gentleman who sticks my mind really well. I actually turned him away. I said to him, I wouldn't even bother. He came to wanting IDD and looked at his scale, and I said to him, this is so bad, you're going to need surgery. Please don't waste your money with me. Just go and have the surgery. I don't want, And he insisted, and he was actually symptom-free within 7 sessions. So since that experience,
remind me why we got you in to tell us how to assess patients for IDD.
But that's what I'm saying. You can never. It's not like a crystal ball. You can only give them your best. Best theoretical kind of what I think is going to happen. But reality can be different sometimes. And equally, you can have the opposite result. You can have somebody who thinks is a textbook case, and for whatever reason they don't have the outcome that they want. So. I generally say to people, it's about 2 out of 3 people will respond very well, and the majority of them are going to need around 20 sessions. Some a little bit more, some a bit less. But the minimum that I've ever seen somebody literally turned around in is about 6 or 7. So I personally say, unless you're going to be in it for 6 or 7, don't bother. Think of 6 to 7 as a minimum, but don't expect to be, because that's only for probably 5% of the cases. If you're going to try it, you've really got to be prepared to give it that good 20 odd sessions.